evening. Welcome to ONV as we present a healthy conversation. I am Nurse Pat. Tonight our conversation is prenatal care. And I have with me tonight a Hope Center. Our guests are Michelle Shanefeld and Nurse Sue. And I'm going to let them introduce themselves and tell us what a Hope Center is and what it does. Go ahead, Michelle.
Okay, so I am Michelle Shanefeld. I'm the executive director at a Hope Center. I've been in this position for about 2 years, though I've been affiliated with a Hope Center for 17 years. And Sue has actually been affiliated longer than I have, going on like
Perhaps.
19.
I don't know that long, but long, yes.
Oh, good. Now, what is a Hope Center?
A Hope Center is a pregnancy resource center. We are faith based, nonprofit. All of our services are free of charge to our clients. Our clients receive all of our services at no cost. We have pregnancy testing, ultrasounds, STI testing with treatment vouchers for positive testing. For tests, we offer incentive based education with over 250 lessons that also is in Burmese and in Spanish with our groups. We have a group class called Mocha Mamas. Those three classes are offered by medical professionals who facilitate those group classes to bring all of your pregnancy and parenting related questions on a weekly basis. And we give referrals within our center, within the services of our center, and within the community. And our goal, our main goal, we want to do is we want to make sure that every woman in our community is supported and walked alongside of until the baby is 3 years old. We don't want anyone to feel so unsupported that they feel that their only option is to do something they maybe wouldn't want to do. In most cases, women want to parent their babies.
And Sue, in your position with a Hope Center, how do you help these women when they come in? What is your role with the women?
My role is to greet them, make them feel comfortable, and then find out about their physical health, their mental health, their experience with parenting. So, really, we go through a assortment of questions that they've already filled out, but we want to know about their general health. Do they have any allergies? Do they have any health conditions that would affect their pregnancy? And then, of course, another important facet is, do they have a habit of smoking or drinking or drugs, marijuana included? Often they don't count that. So I always have to specifically say, how about marijuana? Because all these things will affect a healthy pregnancy. And if they do have some usage of any of these things, then we can tell them the risks to themselves and to their potential baby if they test that they are positive. So once I gather a general health physical from them, a health history, then I will then do a pregnancy test. And if they have desired to have a sexually transmitted disease test, then I also take that specimen and then we send that out for a week, and then she comes back the next week for that. If she would test positive for the two sexually transmitted diseases that we test for, which is chlamydia and gonorrhea, then we also then give them education about all the sexually transmitted diseases so that they really understand the risks that they're putting themselves and their baby with having an uncommitted sexual activity, that there is a risk with this. And so, again, education is a great big part of what I do as I do an intake and meet with our clients.
Okay. And Michelle, now what is your age group that you mainly see? And what is normally their economic standards?
Yeah.
Are they married, single? How
Yes.
those type of things that you deal with?
Yeah. So our core group of clientele ranges from the age of 15 to 24 years old. But we do have, it goes up to about 25 or 35. So 15 to 35 with the core chunk of it between 15 and 25 years old. Now, almost all of our clients are low income or poverty level, and nearly all of them are single. About 63% are minority. Um, Most of them either either they about 94% do qualify for WIC services if they are positive for pregnancy. So we are seeing a lot of lower income um, people who wouldn't necessarily be able to get their services if they even had to pay a small copay.
Okay. Now, why is prenatal care important? And Sue said something about smoking and marijuana.
Mm-hmm.
Everybody do a little pot every now and then. You'll hear that from our young people.
Mm-hmm.
So why is it important to stop if you're pregnant?
Right. Well, so the thing is, pregnancy every week of pregnancy is affected by anything that could be considered a teratogen entering into the body, something that you don't want, such as alcohol or even certain types of chemicals or that you're exposed to. But the prenatal care is so key because early on they're tested for things like making sure that there is a viable pregnancy that is located in the proper place, which is in the uterus, not the tubes, where there could be an ectopic pregnancy, which is about 1 to 2% of the time that can be the case. Then there is also testing for the Rh factor. If you have a mother that has negative blood, and her baby would have positive blood, she would start to produce antibodies. Maybe wouldn't necessarily affect the baby early on, but it will definitely affect future pregnancies or maybe further on in the pregnancy. So if that's necessary, you're going to want to make sure you get a ROGAM shot. You're going to want to make sure that you're having your blood pressure monitored for preeclampsia. That is specifically a concern if you are in the teen years or a young mom. Um, when you're younger, especially when you're younger, a lot of times they haven't maybe told their parents or uh, anybody at all that they could possibly be pregnant. Um, those are the clients that have delayed their prenatal care oftentimes. And that is only detrimental to the client and the baby. If there's any untreated sexually transmitted infections, that is detrimental to the pregnancy as well. And there's so many that are very curable, like the chlamydia and gonorrhea. Chlamydia, both of those are curable with antibiotics. And chlamydia can you can have it for a long time without having the visible symptoms because the symptoms can be so vague. So something like that is very common for people to have and not know it. And they can be treated now in Allen County and nationwide. Syphilis is on the rise, and it was a time where that was almost
Eradicated.
yeah, it was almost completely corrected, but now it's grown 84% in Allen
Oh, wow.
County, and that's something that could cause serious birth defects, brain damage for the baby, and those another example of something that can be cured with an antibiotic.
Okay. Now, Sue, Michelle made a point there. I'm going to put myself in this position. I'm 15 years old. Well, I'm pretty sure I'm pregnant, but I haven't told mom. Actually, haven't told anybody. So I have not. I smoke. I vape every now and then, but now I can't hide it any longer. And I come to you. What are the steps that's going to be taken once I come in and I tell you these things? Yes, I'm pretty sure. And yes, I do smoke a little weed. My friends and I vape every now and then. Cigarette, not often, but I do those things. What is your advice to me, and how are we going to go forth?
All right. Well, again, I would confirm her suspicion first and come back in with a positive pregnancy test and a proof of that so that she has it in her hand how far along she is and when her expected due date was. So that is proof for her to show her doctor, which I will give her a list of doctors that then she can go and make an appointment for. I also give her a bottle of 3 months supply of prenatal vitamins and explain to her why it's important for her to take one each day for she and her baby. And then we talk about you've got three choices here. What are you thinking about with this pregnancy? You can carry and parent. You can carry, place your baby for adoption because maybe you're not ready to parent. But we know very many people that are ready to parent and have empty arms. And this is such a wonderful gift that you could do for others. Or the third choice, of course, is abortion. And all these choices are very hard. Now, if she chooses that she knows she wants to parent this baby, she wants this child, but I don't know how I'm going to tell my parents. And I also help to remind them that while as a parent, we aren't always pleased with what our children do, we always love them. And if she could just give her parents or her mother some time to adjust to the shock that she gives her by saying, I'm pregnant. I just found out I'm pregnant. Give her some time that I am almost certain that she will help her then with this journey and know how all the things that she might need. As far as now, I know that you've said you smoke and you vape sometimes. This is real important if you are going to parent and take care of this baby that's growing within you. And it will affect that baby because it crosses the placenta line. And I have charts that show their anatomy so that they know and understand what's going on. So again, I would give them the risk, the harm that it could be for their baby. And wouldn't they be willing to do that, to sacrifice that habit or desire for at least 9 months and maybe even further if they breastfeed?
Okay. So even if I have been doing it, I can stop
You bet.
and it will lessen some of the risk.
You bet. And we have resources that we can give them to help them quit,
Okay.
that really support them. Yeah,
Okay.
through
Now,
Parkview.
how would I find out about you? I know nothing about this facility that's out here to help me, and I'm 15 and all of these things are happening. How am I going to find you?
Okay, so you can Google search us, of course, Pregnancy Resource Center in Fort Wayne, but it's ahopecenter.org. And that's our website. You can also call us at 422-3544. And on our website, we also have a 24/7 nurse text line. There's always somebody who will answer the phone, even if it's our after hours option line center. And our text line is staffed by 24/7 nurses to to answer questions in the heat of the moment that maybe you've done a pregnancy test at home and you're distraught and it's 10 p.m. at night and you just need to talk to somebody right now. We are there. Our goal is to reach you as soon as possible and reach you quickly. So even when we are not in office hours, there are resources connected to us that you can connect to a nurse to get your questions answered. A lot of times people will make decisions based on fear and really, really quick out of fear, and we'll just be there to walk alongside of them. And we say, we don't perform or refer for abortions. We give education on all of the risks, all of the options. We're upfront and honest and we say, that's not what we would want for you, but we do realize that some of our girls do make that choice. And we still share the love of Jesus with them, even though it's not what we would want for them. There are some times that people have made that choice and they are maybe regretting that decision years down the road. And we have grief support. It's called Forgiven and Set Free for those who are post abortive. But if they have also a miscarriage, that does happen in 1 in 4 pregnancies. So a lot of times when girls are very distraught and they're scared, they're coming in, that they say in the first trimester, 1 in 4 pregnancies does end in miscarriage, and there's nothing usually people can do to stop it. It's just was not a viable pregnancy. So we will tell people, come in and get your ultrasound. Make sure you have a viable pregnancy before you were to make any decisions out of fear. You wouldn't want to pay the money or put your body through anything that you wouldn't need to. And there's times that girls that maybe they didn't want that pregnancy and they were very upset about it. And maybe then they decided, I do want to parent this baby, and then they miscarry. Okay? Sometimes those girls are struggling the most and they feel that maybe God's punishing them. And they're suffering in silence because they haven't told anyone they were pregnant. Or if they did tell people and they let them know that that they had lost the pregnancy, they may hear things like, well, maybe that was for the best. And that certainly wasn't comforting to those who maybe have went through that. But we try very hard to make sure we are accessible to everybody and to get them in as soon as possible. We provide lift services so that if there's a barrier to transportation, we can send a lift to and from our center. We provide language translation services in over 350 languages.
Well, that's good to know because I'm hoping that if there is a young girl out there, and maybe not so young, but is struggling right now, you've said something that will make them want to reach out because I do know, being a nurse myself, working in a doctor's office for a very long time, when a young girl finds out that she's pregnant, it's not easy, number one. It's not easy on the household. So, and they are lost. So, the word hope in itself is letting them know that it's not a lost cause, that there is somebody out there that's willing to listen and willing to offer help to them. And your locations, do you only have one location in Fort Wayne, or where are you located?
Yeah, we have 2 locations. One of them is very close here, right next to Southside High School on Clinton at 3702 South Clinton Street. And the other one is over northeast by Hobson and Coliseum, not quite the corner there,
Okay.
but right next to DeVita Dialysis,
Okay.
and in between Sweet Spot Golf and those 2 right on Hobson Road there. And we are open Monday through Thursday, and each Fort Wayne location alternates late nights on Thursday evenings. So the Clinton location is open the first and third Thursday until 8 p.m.
Mhm.
And the Hobson Road location is open till 8 p.m. on the second and fourth Thursday, so that we can get in those later hours. If some people are having their job or their work, or maybe they're going to school and they have extracurricular activities, that they can still get in on an appointment with us.
Okay, now, do you offer sex education, or you just, if they're pregnant, and do they have to have an appointment? Are you a walk-in? Can they come in and talk to somebody?
Yeah, absolutely. So yes, you may you may come as a walk-in, and we do not turn anybody away. If you come in, we want to see you, and we will do our best, even if we have to bring a nurse from over another center to get you seen that day. Now, sometimes you may choose to come back if the wait would be a little bit longer. Um, but we will do everything we can to get you in. And the as far as the sex education, we have what's called sexual risk avoidance program, and our SRA program
Yeah.
is it's new. It's in the startup,
Okay.
and it is we're wanting to grow it. We have 3 nurses that are trained as sexual risk avoidance specialists through Ascend. It's a national credentialing organization, and they are trained in I Decide for Me, the Indiana. That curriculum is written to Indiana state standards, and we are looking to get into all schools, 8th grade through 12th grade, youth groups, community organizations, any place that will allow us to come in and do 6 sessions with their group. Um, sexual Sexually transmitted diseases are quite an epidemic. In fact, in Allen County, it was declared an epidemic in 2017.
Oh,
And people don't really realize that because nobody's really talking about that. The girls will come in mostly concerned about being pregnant. However, you can get a sexually transmitted disease every day of the month and in ways that you can't even get pregnant. Um, so we want to make sure that people are aware of that risk. So many times we have girls say, "Oh, if I only knew." And I think that they feel like, if they've just had one partner or 2 partners, and that they're not really at risk, but it only takes one time.
so a lot of what you have said, I mean, is very informational and to the young girls out there. Now, boys, do you offer anything to the young men, or is there somewhere they can go if they wanted to learn about sexual transmitted diseases? Or, you know, we
So,
know that some pregnancies are preventable. There are ways to prevent them. Or is there something that they can go out there and learn about it too? Because we know sex is happening.
yes. So here's the thing. We do, our sexual risk avoidance program does include the male students. Our health services, as far as our testing goes, is only for the girls, as
Okay.
we're primarily a pregnancy resource center. Though
Okay.
we do offer things for the father of the baby and mentors, and they can do the educational programs, then walk alongside of them until the baby is 3 years old as well. But we do have the sexual risk avoidance education for the boys as well. Now, at a Hope Center, we state that the only 100% way that you can be sure to not get pregnant or to get a sexually transmitted disease is either by abstinence or being in a mutually monogamous relationship, such as marriage is designed to be. And not being the sex police or anything like that. We're trying to not be
Yeah.
be in an ivory tower and say this. We're just want to humbly say, the Lord give us those provisions because He wants to. He doesn't want to kill our fun. It's like having a nice fireplace in the fire. In a fire in the fireplace where it belongs, it's nice and it's warm and it's beautiful. But if that fire gets out somewhere else, it will just destroy an entire house. And there's always risks that are involved when sex happens outside of marriage. And those risks do happen that you may end up with as a single parent or a sexually transmitted disease. With the Allen County Board of Health now saying that there's a 1 in 2 chance of people getting a sexually transmitted infection, those are not good odds. Those are just scary odds. And even when safe sex, I say it in quotations, is practiced, it's really not safe. Maybe less risky, but safe is really not the proper word for it. So even that's why we don't promote condom usage, because what's found is when people are using forms of birth control, they've increased their risk for sexually transmitted infections by 10 times because it's happening more often. You can, if a condom was used every single time with somebody who was infected with gonorrhea or chlamydia, it would decrease your chance in half of getting that disease. Now, it's better for HIV, it's better for pregnancy, but 1 in 2 could still be passing gonorrhea or chlamydia. And one thing we want to definitely make sure is that young girls know that when they're pregnant, it's not a good time to be promiscuous. So some may say, well, I'm already pregnant, so
Oh, yeah.
what's that going to change? Well, it can change everything. If you get a disease and the baby, you can enter in preterm labor, and the baby can have everything from brain damage to heart damage, warts of the airway and throat. It can have problems with the liver if it's hepatitis. Just so many things that you want to make sure that you don't contract during pregnancy, especially. It's the time to be, if you're going to abstain, it's definitely the time to abstain.
Well, ladies, I really appreciate this. This is a conversation that could pick up next week and still talk about something totally different. And I really appreciate you coming here tonight talking about prenatal care and letting our young people know there is hope if they find themselves
Yes.
pregnant in an unplanned pregnancy or with a disease that they may think, oh, I'm so afraid to tell somebody I have this disease. But if it's caught in time, treated in time, it can be cured. And I really do appreciate you coming here tonight to talk about this and letting our audience know that there is hope out there and there is a Hope Center that they can contact and find all of this information and find all of this help that a lot of people is not aware of in our community. We have people that I'm pretty sure that's sitting here like me going, ah, that is really there. That there are people that really care
Yes.
because it takes care. And what you're doing, it sounds like you not only offer services, but you offer love and compassion to your clients that walk in through your doors. And thank you for that. And the numbers, the statistics that you pointed out tonight, people, take it in and reach out to these ladies for your help if you need it. And as we always say when we're getting ready to close out here, is always protect your mind.